Well, it has been called an epidemic. Diabetes impacts 9 million Canadians, and that number is expected to grow. Many diabetics lose sensation in their feet, making them vulnerable to potentially fatal infections. It's a serious problem, but a Calgary doctor may have found a way to bring those old feelings back.
Bruce Howell first learned he had diabetes 10 years ago. Soon after, he began noticing problems with his feet.
Just my feet were very, very sensitive and like a tingling sensation. And then when I went to the diabetes clinic and some of the education that they provide, that's what made me aware of, how diabetes does affect your feet.
Over time, high blood sugar can damage nerves in the hands and feet. Without sensation, an injury can go unnoticed until it's too late.
These patients end up developing complications such as ulcers. Those ulcers can become infected. Some of those require amputation, and some patients actually die from the complications.
Right now, patients are told to check for injuries daily, but that's often not enough to avoid infections. This insole, however, could help.
We're developing an insole that's a pressure-sensing insole for diabetics with peripheral neuropathy. And what it does is it restores sensation in the feet for people who can't actually feel their feet.
With nerves damaged in the feet, information about pressure and vibration is collected by sensors and delivered to a receiver placed on the patient's back.
Over time, those patients are actually able to rewire their brain to interpret what they're feeling on their back as what they would normally feel on their feet.
Small sensations that could prevent serious injury. The product is still in development, but is scheduled to enter the market by the end of this year. Bruce is looking forward to it, happy for anything that can keep his health in step. Heather Yurex, Global News.
Now, that device is also connected to a watch that can alert the diabetic to any potential problem.